What causes incontinence recurrence after bladder sling surgery? Incontinence recurrence after bladder sling surgery can be a frustrating experience for many patients. Understanding the reasons behind this recurrence is essential for effective management. Several factors can contribute to the return of incontinence after procedures like mid-urethral sling surgery, which is commonly used to treat stress urinary incontinence. One significant factor is the possibility of incomplete or improper sling support. If the sling is not positioned correctly, or if the tension is not adjusted properly during surgery, it may not provide adequate support. This can lead to ongoing or returning urine leakage, even if there was initial improvement after the surgery. Another aspect to consider is the effects of sling revision or removal. If a patient undergoes additional surgeries to address complications such as urinary retention or pain, the risk of recurrent incontinence can increase. Research shows that techniques like partial or complete sling excision can lead to higher recurrence rates, sometimes reaching up to 66%. This happens because removing or cutting the sling reduces the support it provides to the urethra. Time also plays a role in recurrence. Longer intervals between the initial surgery and any revision surgeries can be linked to higher rates of incontinence returning. Over time, changes in tissue such as scarring or erosion of the sling can affect its effectiveness, leading to recurrence. Patient-specific factors are crucial as well. Older age, having multiple children, and certain urodynamic characteristics can increase the risk of complications after surgery. For example, low flow rates or low voiding pressures can affect how well the sling functions in maintaining continence. Additionally, an incorrect initial diagnosis can lead to recurrence. If the type of incontinence was misdiagnosed, or if a patient has mixed incontinence, where both stress and urge incontinence are present, a sling procedure may not fully resolve symptoms. The surgical approach and type of sling used can also impact outcomes. Some studies suggest that repeat surgeries using a retropubic approach may be more effective than transobturator methods in cases of recurrence. However, repeat mid-urethral sling procedures can still yield good results when performed carefully. In summary, incontinence recurrence after bladder sling surgery is influenced by various factors, including surgical technique, patient characteristics, and time-related changes in tissue. A thorough preoperative evaluation, including urodynamic testing, is vital for optimizing outcomes. After surgery, a stepwise approach to managing any recurrence is essential to identify the underlying causes and guide further treatment. Always consult with a healthcare professional for personalized advice and management options.